All right, we're going to get started here in about 4 or 5 minutes. All right, about 2 minutes until we get started. For those of you who haven't been in one of our webinars hosted on this platform before, there is a chat box, a live chat box for those of you that are going to be watching during the live viewing at 1 p.m. That you can type in, but you do have to be logged into a Google or YouTube account in order to do so. So we have about a minute or two here till we get started back up if you wanted to get logged into a YouTube or Google account in order to comment in that box. But that's not totally necessary. You can also just refer any questions to my email as well, and I will follow up there. For anybody that's watching a recorded version of this webinar, you can also just follow up with questions via email, which I will have on the next slide here before we get started. All right, it is 1 o'clock, so I'm going to go ahead and get started. We've got about 15 people in here now. I know that we had 60 or so register, but a lot of people do watch the recorded version later, so I'm going to go ahead and get on into this. So we're going to talk about safety in the office today. We will have a section about COVID-19 requirements via the Safe Start program in Washington, so we will discuss that as well. First, a little bit of background on me. I am based in Phoenix, Arizona, but I do work on site in Washington about 1 week every month. I am up there. Unfortunately, due to COVID-19, I have not been up recently, but it looks like we are going to restart our site visits in July, as long as some other things don't change. It's going to be dependent upon the Safe Start status of county by county in the state of Washington. I've worked on site both domestically and internationally with clients in 40 states and 5 countries. Background on me as far as work history: started out safety and industrial hygiene for Zachary Engineering in Texas. From there, I went up to Marathon Petroleum in Findlay, Ohio. I was a health and safety coordinator on a pipeline construction project in Southwest PA. And for the past 4 or 5 years, I have been working here for CareWorks Comp and Compwise as a safety and risk management consultant. And I am also a contracted global fall protection confined space rescue and body recovery trainer, subject matter expert for MSA, the safety company, as well. My email address is over there under my picture. I will be emailing out a PDF copy of these slides, so you will have all the information from this presentation as well as my contact information. My LinkedIn is there as well if you want to follow me on LinkedIn. I post articles and updates there quite frequently as well. Some administrative information before we get started. During the live presentation, it will be recorded, able to be accessed in the future through this same link. You can and are encouraged to ask questions as we go along using the chat box feature that's on the right side of the video on your screen. If you're on a mobile device, it may be below the video. If you're watching the replay, please email all questions to john.valentine@careworkscomp.com. So let's start out by figuring out what can go wrong in an office. There can be all kinds of issues, including absences, sickness, conflicts, as well as injuries, which could be physical injuries, psychological injuries, or illness and disease. And anytime we have any of those issues or injuries pop up, we're going to see our bottom line go down, our profit margins get tighter and tighter, and eventually go into the red. We've seen an extreme example of that during this COVID-19 crisis, but we're going to talk about the things that we can keep control of within our own workplace today. So we'll start out with the types of hazards. The basic hazard categories are going to be physical hazards, chemical hazards, biological hazards, which is the section in which we'll discuss COVID-19, ergonomic hazards, psychological hazards, and behavioral hazards. Give me 1 second here because I just noticed that my notes are not popping up on my screen. So let me find that window, and there we go. All right. And lastly, there is behavioral hazards. So that's going to be employees that have bad habits, performing unsafe actions. So we'll start out by talking about chemical hazards. This is going to be covered by the Global Harmonized System, the GHS Hazard Communication System. There is a WAC code for it as well. It's verbatim from the OSHA documents. There are many chemical hazards. Most are left unchecked and unmitigated in office environments, especially in maintenance areas. So I'm going to talk a lot about your maintenance departments and your janitorial services when I discuss chemical hazards, because they're the ones that are at most risk for chemical hazards. Those chemical hazards are going to include things like cleaning agents. As far as office environments go, toners, developers, and ink, solvents, paints, fuels, adhesives, and then employees also often bring in unapproved chemicals to the workplace to clean things and stuff like that. So we need to make sure that if employees are bringing in chemicals to clean, there's nothing technically wrong with that, as long as we are vetting those chemicals to make sure they're safe for the workplace, and we are putting an SDS on file for any outside chemicals that are coming in. Usually the easiest thing to do is just ban people from bringing in outside chemicals without prior permission and bringing an SDS with them. SDS stands for Safety Data Sheet. So one of the questions that I often will ask if I'm auditing a company, whether it be a manufacturer or an office building, it doesn't matter. Your employees should be able to, if they work with chemicals, they should be able to positively ID the meaning of each of those pictograms here that are pictured on the right side of the slide. Oftentimes, if I go in, that's my litmus test for whether or not they've been properly trained on GHS and HAZCOM. So do you have the following in place? Is there a HAZCOM or GHS training program? That should be trained from onboarding. The day they show up for work, their onboarding training should include hazard communication and GHS for anything that would apply to their role. If they aren't going to be someone who's working with chemicals regularly, you should still train them to an awareness level because there are chemicals present somewhere in your workplace. Um, I also recommend refreshing HAZCOM GHS training annually because though it takes some time up front to refresh the training, doesn't take much time at all. Safety data sheets for every chemical in your workplace, you should have those available, and every employee should know where to find the safety data sheets and what they are used for. Those safety data sheets should meet you can put new in air quotes, GHS standard layout. They changed how those SDS sheets look back in 2012. So by now, any SDS sheets you're getting from manufacturers should be up to date. Just check for any old ones that you have that don't follow the new layout. You should also perform an annual review of SDS, HAZCOM, and GHS program to ensure compliance, make sure things are being properly labeled, your SDS sheets are being tracked and kept accordingly. Emergency eye wash and first aid available. So every workplace should have first aid kits available. As far as emergency eye wash goes, obviously you're going to not need that all over your office building, but for your janitorial staff who are pushing around a cart full of chemicals on a regular basis, spraying chemicals, they should have one of the portable bottles of emergency eye wash available to them, whether that be near a first aid kit or right there on their cart that they're pushing around if they're pushing around a janitor style cart. Emergency showers for workplaces with more serious hazards. As far as office building goes, about the only place you may need an emergency shower would be your maintenance department if they have some harsh chemicals or large supplies of chemicals, for example, barrels of pesticides or something like that, where they could get a large amount on their body and need to rinse it off quickly. Proper chemical storage should be being followed. To find the information on how to properly store your chemicals, you can just look at the SDS sheets for those. Pay careful attention to your volatile chemicals, your explosive or flammable chemicals, reactive or self-reactive chemicals. Make sure things that are supposed to be in a flame-proof cabinet are in a flame-proof cabinet. Those are often the low-hanging fruit that L&I, when they come out and do an inspection, they are going to catch that stuff in a hurry because they know that that's the stuff that office environments are typically bad at doing, and it's hard to find violations in an office environment unless they're easy violations like HAZCOM. Proper use and labeling. Make sure that all your chemicals are labeled if you put them in a secondary container, that secondary container is labeled to the GHS standards to include the name of the chemical that's in it as well as any dangers or pictograms that would go with that. Any chemical that's kept in its original consumer style labeling is fine. You don't need to put any additional labels on that. For example, if you buy a bottle of consumer style Windex and you keep it in that bottle that has the manufacturer label on it, you don't need to put any other label on that. That was a kind of boot camp, real quick run through of HAZCOM and GHS, high level overview. Moving on to biological hazards. This is where we're going to talk a little bit about COVID-19. But first, we're just going to talk about biological hazards in general. This is not COVID-19 specific right now. So basic infection prevention measures that you should have always had a policy in place for, but what we realized as COVID-19 came in is that many companies did not have an infection prevention measure policy in place. So that's something moving forward that all these companies can improve upon. So we want to promote frequent and thorough hand washing. We want to encourage workers to stay home if they are sick. That is something that the work culture in the United States has done poorly at in the past, but I think that COVID-19 is a learning experience for that, and moving forward, many companies are going to have better sick policies in place because a lot of companies found out the hard way that when a serious illness hits your workplace, if one worker gets sick and they come to work and get everyone else sick, you're going to have to shut down whether the government requires it or not. And we've been seeing that on the news with some of these large meat production factories because you have a lot of workers in close proximity. Once one gets sick, a bunch of them are going to get sick, and suddenly you have no workforce left until they all get healthy. So we can encourage workers to stay home if they're sick, both actively with policies such as paid sick leave when appropriate, as well as with teledoc services, which are often fairly low cost as far as benefits go, that can assist in determining whether a worker should go home or stay at work or come to work. Teledoc service, they can call from work or they can call the teledoc before work. Oftentimes those are 24/7 services. They can discuss symptoms over the phone and at least give an initial prognosis, not necessarily a diagnosis, but a prognosis to determine whether that employee needs to go see another doctor in person or whether that teledoctor thinks that they can go into work and aren't going to pose a threat to other employees as far as illness goes. You should discourage workers from using other workers' phones, desks, tablets, tools, and equipment whenever possible. And make sure you maintain your regular housekeeping practices, including the routine disinfecting of surfaces, equipment, and other elements of the work environment. And that is something that I think we have increased during COVID-19, but I expect to see that stay increased pretty much from now on. I don't see that ever going back to the low rates of disinfecting that we used to do. I think that cleaning is going to start to be an important facet for all businesses now. And anytime an emergent infectious disease is identified, you should have a policy in place, an infectious disease preparedness response plan, so that when this is a term the CDC uses, when an emergent infectious disease is identified, so when they start to see something that could potentially turn into an outbreak or a pandemic, they are going to release information about that, and you should have a policy in place that states you're going to refer back to the CDC, OSHA, Washington L&I, Washington Department of Health, in order to get more information on responding to the threat and actively change your policies to deal with that like we are doing now for COVID-19. And that is something that the Compwise Safety and Loss Prevention team can help you with. We can assist you with writing policies such as an emergent infectious disease policy or an aerosol transmissible disease policy, just to have you something that's kind of a general template in place for when things do get out of hand like COVID-19 has. You are prepared in advance and you have the systems in place in order to have a person who is responsible for conglomerating this new information as it comes out from the CDC and OSHA and turning that into policy and keeping your workers safe. An example of these sources is here, the links down here at the bottom. I'm not going to read through these, but I will pull them up to show you what they look like, and you can go to these web pages to find all kinds of information. The AWB actually, Compwise program, has created their own tools for COVID-19, which I'll have a link to in the presentation as well. And again, I will email out a PDF to everyone who is currently registered for this. If you're watching the recording and you registered after the live webinar, shoot me an email and I will also send you a copy of the slides. But for everyone attending right now during the live one, you're going to get an email shortly after. As far as the COVID-19 specific guidelines in the state of Washington, these are the guidelines that apply to all employers, and they are mandatory as part of the Safe Start program. Additional guidelines may apply to you if you're in a certain industry. I will have a link to where to find that here in a moment. There are Compwise industry specific guides. Some of you may have already seen these. We have specific guides out for the retail industry, for the manufacturing industry, for the hospitality industry, and for the facilities and property management industries. For some of those, like hospitality, it's mostly geared towards the restaurants, but I have a lot of information in there for hotels as well. But to give you an idea of what these guides look like, it's in the news and tips section, and you'll click on a guide. Let's look at the manufacturing one, for example. We'll click here to open it up, and these are quite long documents. They're about 20 pages apiece. A little message from the AWB, then it goes into the reopening phases as well as the general requirements for everybody, and then it goes into the requirements by phase depending on what industry it's geared towards. So here this manufacturing one has all the information for the manufacturing sector. So we've pulled all that information together. The beginning of these documents are all legal requirements, and then after that we have best practice recommendations, and these are going to go much further than what we're going to talk about today in our brief presentation. So feel free to go take a look at these, even if there's not a guide specific for your industry. We made these guides only for the industries that got specific mandates from the state. But if you're not in one of those industries, you can still open this up and take a look at this best practice section to see what can help you in your workplace and pick and choose out of here what applies to your workplace. We also have information on combating fear about coronavirus in the workplace, how to make sure your employees are confident that you're doing everything the right way, and information on returning to work safely after a long break, because people are more apt to get injured after a long break from work. And then there's frequently asked questions at the bottom, and then a whole lot of resources specifically on coronavirus. So we do at the AWB have those resources available for you. Also, when I give these slides to you, there will be a link to the Safe Start Washington information with everything you need to know about Safe Start Washington directly from the state. That's what this website looks like. And then also we have those industry-specific requirements I told you about. We made guides for the ones that apply to groups of folks in our Compwise sponsored group retro programs, but there are other industries here that you may belong to, or you may have clients that are in these industries and you're working on their job sites. So I linked this article just in case any of these guides would apply to you, or these list of guidelines from the state would apply to you, so you can check those out as well and revisit these often, because they're constantly updating this, they're constantly adding new things. Okay, that being said, I do have a disclaimer on the bottom of this slide. Any legal information I'm giving you regarding state Safe Start Washington is as of the date I compiled the information. It does change rapidly, so before you make any decisions about changing policies based on this, make sure you go double check that those rules and guidelines have not changed yet, because those do rapidly change. All right, so office-based businesses were not contained within if you were not contained within an essential industry, you are allowed to reopen when your county hits phase 2, though telework is still strongly recommended where possible. Most employees must wear a facial covering or a face mask in office buildings, except those who work alone or individuals who are deaf or hard of hearing, or who communicate with someone who relies on sign language as cues, in which cases if you're using reading mouths or reading lips, make sure you're keeping that 6-foot plus distance while you're doing that. You don't want to be very close to someone while you're doing that. Employers are required to provide the facial coverings or masks to employees. There are PPE shortages right now, so when you can get them, get what you can, and be creative. It may be hard to find medical masks. Do not get N95s. Those, we are trying to restrict the use of actual N95s to healthcare professionals and folks who need them in a high-risk environment. But just a simple cloth face covering it works. You can get creative. You can get with anyone who's crafty. If you have any crafty employees who are sewing them already, you could work with them to either donate some, or you could pay for the materials and time for them to create them as well if you're having trouble finding them from a distributor. So we got to keep in mind that supply chains are going to ebb and flow as the demand hits in high waves as places reopen. General requirements for all employers during all phases. So when you do open back up, you have to make sure you meet these requirements. Employers are required to maintain that 6-foot physical distancing requirement for employees and patrons. And where you are not able to keep 6 feet distancing, you have to use alternative measures, whether that be barriers or using masks, but you really want to limit that close proximity time. Provide services while limiting close interactions with patrons. Provide adequate sanitation and personal hygiene for workers, vendors, and patrons. Ensure employees have access to hand washing facilities so that they can wash their hands frequently with soap and running water. Make sure you provide enough fixed or portable hand washing facilities. In an office building, you should have your restrooms already established. Shouldn't be an issue there. Just make sure you're keeping the soap filled. Ensure an adequate supply of soap, water, and towels. Set up a schedule for frequent restocking of supplies and emptying of trash. Require workers to wash their hands frequently and effectively when they arrive at work, when they leave their workstations for break, when they use the restroom, and before or after they drink or use tobacco products, and after touching any surfaces suspected of being contaminated. We got to remember that one of the biggest vectors for getting infected with COVID-19 is going to be your hands coming to your face. So when you're eating, smoking, and things like that, make sure you wash your hands before and after you do those things. Provide supplemental hand sanitizer stations, wipes or towelettes, or clean water and soap in portable containers to facilitate more frequent hand washing after handling objects touched by others. And gloves may be provided, but also must be washed regularly to prevent the spread of virus. In other words, if you're wearing gloves and you touch something that's infected, everything or that's contaminated, everything you touch after that, you're going to spread that virus to. So even if you're wearing gloves, you still should wash your hands. Even if you have the gloves on, you should wash those gloves once in a while. Gloves oftentimes do more harm than good because folks get this false sense of security with them. But if they're used properly, they are good. You got to make sure when you take gloves off as well, if you're going to use gloves in your workplace, that you train employees to take them off. So gloves can be provided, but I don't recommend them just because too many people are going to misuse them or get a false sense of security unless you properly train them in the utilization of those gloves. And this webinar may run over a little bit. The recording will stay up if you have to dip out for another meeting. But I actually added all this Washington Safe Start stuff after I already had the webinar scheduled. So this is all extra. Make sure you ensure frequent cleaning and disinfection of the business. Establish a housekeeping schedule. Provide appropriate and adequate cleaning supplies for scheduled cleanings and spot cleanings. Ensure that floors, counters, and other surfaces are regularly cleaned with water and soap or other cleaning liquids to prevent buildup of dirt and residues that can harbor contamination. And make sure your high-touch surfaces are properly disinfected. And you're going to use the CDC guidelines for that. So that's another thing to think about. If you have your janitorial staff, review those CDC guidelines for cleaning with them. They are linked in the presentation. And again, I will email this PDF out to you. Make sure that shared work vehicles are clean and disinfected if you have any of those. Ensure employees follow effective cleaning procedures and use gloves, eye, and face protection when mixing, spraying, or wiping with liquid cleaning products like diluted bleach. That's something that in the past many workplaces were not good at, is proper PPE for janitorial staff. Your janitorial staff should be wearing gloves to protect them from the chemicals, and they should be wearing safety glasses as well with side shields at a minimum. Keep your safety data sheets for all these new disinfectants you end up getting in order to handle this coronavirus problem. And don't mix chemicals. Many are incompatible, and be sure to dilute and use chemicals per the manufacturer's specifications. And identify all PPE and cloth facial coverings in accordance with L&I requirements on facial coverings and industry-specific COVID-19 standards. And make sure you're providing the necessary PPE to supplies to employees. So every employee is going to be required to have a face mask, again, unless they're working alone, at which point they can take it off, or if they have a medical reason they cannot wear one, or if they are deaf, hard of hearing, and need the other person to take off the mask in order to lip read. In which case, again, keep that 6-foot distance. Additional requirements: identify strategies for addressing ill employees, which should include requiring positive tested employees to stay home while they're infectious, and restricting employees who are directly exposed to that positive employee as well. Require sick workers to stay home or go home if they appear sick. Identify and isolate workers who are exhibiting those signs and symptoms, including fever, coughing, shortness of breath, or a newly established loss of taste or smell abilities. And again, follow those CDC guidelines for deep cleaning if an employee reports being positive. So at that point, you'd want to cordon off that section of the building that they were working, disinfect that section of the building following the CDC cleaning guidelines, and also the other employees who were exposed to that area should then be tested. Keep workers away from those areas that are being deep cleaned. We actually had a large claim, or not a large claim, but a high frequency of claims come in this year after deep cleaning. Folks went back into the areas before they allowed those areas to properly air out. They ended up inhaling some of the chemicals that were used to clean, and they felt sick because of that. So if you go through a deep cleaning, if they do any sort of fogging, or anything like that, you're going to want to air out that area for about 24 to 48 hours before you let people back into it. Educate employees about COVID-19 in the language they best understand, and the education should include the following: the signs, symptoms, and risk factors associated with the illness, how to prevent the spread of the illness at work, including the steps that you're taking to establish social distancing, And the importance of hand washing and how to effectively wash their hands. So you need to explain to your employees that they need to wash their hands for 20 seconds with warm water and soap. And the proper respiratory etiquette, including covering coughs and sneezes, not touching eyes, nose, or mouths with unwashed hands or gloves. On a case, I believe this is the last of these slides. There may be one more. On a case-by-case basis, as directed by health officials, implement any other best practices. Follow the requirements in Governor Inslee's proclamation, which I have linked here for when I email this out, and keep your facility safe and healthy in accordance with state and federal law, and comply with those COVID-19 worksite specific safety practices outlined in that Stay Home, Stay Healthy proclamation, as well as the Safe Start proclamation, which is now in place. Okay, I know that was a lot of information. It was a mouthful, and I went through it quick. That was meant to just give you a brief overview of those requirements for all the employers. And again, I will email this out because that was a ton of information for me to go through that fast. Now let's talk about ergonomics. Ergonomics in the office environment. So we'll talk about your employee workstations. They should be designed to reduce excessive bending and stretching. Should be fully adjustable. And we're going to want to make sure we have good housekeeping to reduce trips or getting caught up in loose cables and things like that. Never store items on the top of shelves or cabinets, because not only could they fall, but an employee reaching for them can lose their balance, knock things over. And never leave desk or filing cabinet drawers open. Those then become trip hazards, pinch point hazards, and struck by hazards. Sit and stand desks are preferable to get workers on their feet as opposed to sedentary positions for extended periods of time. That being said, sit-stand desks tend to be very expensive. So if that's something you're looking at doing, look at evaluating that based on who needs it the most, as well as putting it into a CapEx budget, because you're not going to want to upgrade all of those at once because it is expensive. As far as the chair goes, you want an adjustable chair. Good chairs have an adjustable lower back support. The height should be adjustable, and you should adjust them so that your knees and hips are level. I just caught myself totally slouching down in my chair, so I just sat back up. But you want to keep your knees and hips level. If your knees are down below, your hips are up above, that's going to be bad long term for your back. Chairs on casters, which are wheels, should have 5 legs. If you think back to pretty much the 90s and earlier, we would see chairs that just had 3 legs on them that were on wheels, and that was dangerous. Those tipped over a lot. If your desk is too high, you can compensate by raising the chair seat height, but you want to make it so that your feet stay flat on the floor. And never stand on an office chair to reach anything, especially if the chair has wheels or swivels. You're going to end up falling off and getting hurt. As far as the computer goes at the workstation, a badly positioned computer not only makes the user unproductive, but it also can cause discomfort. If the monitor is badly positioned, the user will likely suffer eye strain, headaches, stiff neck and shoulders, and a backache. That's something that I caught myself on since COVID started. I've been working from home behind a desk a lot more, which I'm not used to. I found that I started leaning forward a lot at my desk, and I ended up having to go to the chiropractor for that. And it resulted in the muscles in my neck being stiff even when I wasn't at my desk, as well as my back. And it was the chiropractor that kind of pointed that out for me, and I said, well, I should have known better. I literally give webinars on this stuff. So it's hard to catch yourself doing it until you start to feel it. In order to prevent that, we want to make sure the screen is only 45 to 60 centimeters away from the user's eyes where it's set up. You want it to be fairly level with them. Adjust your computer and seating for comfort. There are online tools that assist with that. Washington L&I actually has their own tool on the Washington Labor and Industry website for adjusting a computer workstation. It's kind of like a little video and some slides that you walk through, and it step by step shows you how to set up your desk. It's a great tool. It's something that I recommend that when you hire a new employee, you instruct them to go through that tool on Washington L&I's website while they set up their desk on the first day of work. The top of the monitor should be at eye level to help reduce the risk of neck and back strain. If it's down lower, you're going to have your head bent down looking at it, and that is going to strain your back. If you right now just kind of push your chin down towards your chest, you're going to start to feel that pull up on your spine and your back and your muscles back there. So just moving just your head is going to affect almost your entire back. So you want to be in a neutral position, looking pretty much straight forward with the top of the monitor just at eye level, so that you can see the whole monitor just by moving your eyes rather than bending your whole head. The keyboard should be directly in front of the user, not off to the side. Any user's elbows should be bent at a 90-degree angle. I have mine set up so that my elbows can actually sit right on my armrest and my hands come straight out. The keyboard should be angled to allow the user's wrist to be in a neutral position. Keyboards that are laid flat cause you to arch your wrist up a little bit more, which could lead to repetitive motion issues and other things such as carpal tunnel syndrome. The monitor screen should be positioned at right angles to the window to avoid glare. The two things you don't want to do is have a window right behind the monitor or a window right behind the user or the operator of the computer, because in one case you're going to have a lot of bright light right behind the computer, and in the other case, and your eyes are going to have trouble focusing on your screen because of that. And in the other case, you have bright light coming from behind the user causing a glare on the screen. So you want to have right angles to the windows to avoid that glare. Adjust the lighting in the building to prevent eye strain. So you don't want a very dark building with bright screens. That's going to put a lot of strains on the eye. You also don't want to have extremely bright lighting that's going to overcompensate as well. So you want some neutral lighting. Eliminate glare and reflection, and workers should be seeing their physician for routine eye and vision examinations, because if you're having trouble seeing already and you should be wearing glasses to look at a screen and you're not, continuing to try to focus on that screen is going to put more strain on your eyes than it would if they were wearing glasses or whatever prescription eyewear they would need. It's also important to take 5-minute breaks from computer work at least once an hour and look away from the monitor and focus on other objects that are both near and far to get those eyes moving again. That's going to finish up the ergonomic section. From there, we're going to move into electrical safety. Again, if you have questions, you can put them over in the live chat or shoot me an email. I am moving at a little bit of a faster pace, got a little bit behind there because of the coronavirus section. With electrical safety, cords and devices, we want to be aware of our electrical hazards in the workplace, and we should be training all our employees to be aware of these hazards as well. Obviously, the risk of injury would be electrical shock and burns, as well as fires. And we want to report all electrical problems and concerns to either a supervisor, the building manager, or maintenance. It depends on who's responsible in your building, and you should let your employees know what your process is for reporting these problems, because it's going to be different from company to company. If your maintenance crew is not qualified to handle electrical issues, they should outsource that work to a qualified electrician. I say that and it sounds very obvious, but I can't tell you how many times I've gone into buildings to do inspections and audits, and I am not an electrical professional, but I have seen some stuff that have been very obvious electrical violations that violate local codes, ordinances for buildings and electricity because a maintenance worker decided to fix something themselves that they were not qualified to fix as far as electrical stuff goes. Electrical cords, cables, multi-plug power strips, loose cords and cables, all that stuff can cause tripping hazards, electrical injuries. You always need to make sure you have your cables and cords controlled and tucked away, away from anywhere they could be a tripping hazard, as well as cords that are, say you have a lamp that's up on top of a shelf. That cord that's going up in the air, if someone would bump into that or trip against it, it would pull that lamp then off that shelf and it would hit the employee. So you don't want cords running up anywhere where they could be pulled down and pull something onto an employee. The National Safety Council reports over 4,000 injuries like that a year. Never use excessive cords or devices in your office. Never overload the electrical circuits, so you shouldn't be piggybacking or daisy chaining multi-plug power strips, which is what you see in that blue image there. Multiple power strips that are connected to each other. That's a real quick way to start a fire, overload a circuit. You're not supposed to do that. You can have one power strip plugged into the outlet, but you should never ever plug another power strip into a power strip, or plug an extension cord into a power strip, or a power strip into an extension cord. You also should not use extension cords for permanent use. If you have an extension cord that's being used for permanent use, not only is it a fire hazard, it also is a Washington L&I and OSHA violation, which you can be cited for monetarily. If you have an extension cord that you're using in a permanent fashion, that's a case where you should have an electrician come out and give you more outlets or permanent wiring to whatever area you need it. So again, electrical extension cords are for temporary use only. No unauthorized person may tamper with any electrical appliance, circuit breaker, panel, or distribution board. Don't overload electrical outlets. If you need additional outlets, submit a work request to maintenance or building management or whoever can get a licensed electrician to come in and install more outlets in the areas you need them in. Okay, again, only a licensed electrician should modify that electrical system, and if electrical cable cord or outlet becomes warm to the touch, it must be disconnected and reported without delay. Somewhere you may have seen something like that before would be cheap off-brand phone chargers. If you've ever gotten like one of the off-brand phone chargers from a gas station or from the checkout aisle at the grocery store, those often are made with very cheap materials. They're not designed to last, and folks have had issues with those catching on fire, throwing sparks, or getting really, really warm or hot to the touch. And not only is it a hazard for safety, but it also destroys your phone and your phone battery if you're plugging things in with subpar charging cables. Cables and extension cords also should not run unprotected beneath carpeting, nor should they span walkways without being secured under an approved encapsulation device or cover. A lot of people like to just duct tape them down. That is not an approved encapsulation device or cover. Sometimes something is better than nothing, but we should be doing things the right way. Do not use tape joints or splices to connect cables. Insufficient insulation or protection from liquids in that case, so if it would get wet, you could run into some dangerous issues. And do perform visual inspections of plugs and leads and have them repaired as necessary. Watch out for physical damage to cables, cords, plugs, and outlets. Watch out for insecure connections to the plug, and make sure you switch off all electrical equipment before unplugging it. So you're going to switch it off, then unplug it, and then clean it. Too often people get electrocuted while cleaning things. They shut it off. They think it's safe. You need to also unplug it. Office equipment does pose many lingering physical and ergonomic hazards, so this is kind of a little bit of a review. Electricity, cords, cables, and electrical hazards. Photocopiers and printers. They can be noisy if they're all in a room together. Typically that's not too big of an issue in a workplace, but the inks and the toners can be toxic. Ozone can be an issue, so you want to make sure you have good airflow in the rooms that you have those Xerox machines in, as well as the lasers that are in printers. Typically aren't going to be an issue as long as you don't have workers leaving it plugged in while they open it up to try and fix something in it. Computers and screens, we talked about eye strain, posture, ergonomics, and repetitive motion. And with your drawers, we got pinch points and trip hazards if we leave them open. And one thing we didn't talk about yet that I'll talk about a little bit later when we get the lifting safety is going to be carts, push and pull ergonomics, struck bys, and overexertions. We will talk about those a little bit later. Okay. So we want to make sure we learn how to operate office machines safely before we use them. Use caution to keep loose clothing, jewelry, and long hair out of machines. Copiers, printers, anything that has rotating machinery in it can grab hold of those types of things. Keep your hands and fingers clear of shredder inlets if you're using a paper shredder, and switch machines off and unplug them before trying to clear a blockage in your printers or paper shredders. And use tools to clear blockages, not fingers. If you use your finger, it's going to get nipped. If you use a tool, the tool gets nipped and nobody gets hurt. Make sure you look after your hands anytime you stick them into drawers and cabinets, when you handle papers, staplers, and other office devices, and keep sharp objects in safe containers. Your safety pins, your push pins, your X-Acto knives, scissors, things like that. Keep them in safe containers or guard their blades and points so that you're not getting poked or cut. And then moving on from office equipment, we'll talk about slips, trips, and falls. Now we do have another entire webinar that's dedicated just to slips, trips, and falls and overexertions. If you want to check that out, it's also free on our website. But this is just going to be a brief overview of slips, trips, and falls in the office environment. You can prevent them by always remembering the following. Don't allow cords and cables to create a tripping hazard. Clean up all your spills quickly. And don't block passageways and walkways. Keep office areas clean, neat, and organized. Keep stacking and storage areas safe. And report all hazards or concerns to a supervisor. Watch where you walk and be alert for worn or loose carpets. And if you find these things, make sure you notify maintenance or a supervisor so we get them fixed right away. Any broken stair tread edges, uneven or broken walking surfaces, chipped floorboards and tiles, and pick up objects that fall, including things as little as pencils. Those are all tripping hazards. And use caution when wearing high heels. Honestly, I encourage you to actively discourage the wearing of high heels in the office place. It's just not necessary anymore. Most office places are going to business casual, and even in formal business attire, it's not necessary to wear heels. But that, again, is a decision you can make as a company. As far as stairs go, avoid distraction on stairs. Take them one step at a time. Don't skip stairs. Don't load your arms so full of items you can't see. Not to mention, you should always have at least one arm free, preferably your right arm and right hand, in order to grab the banister or handrail. You should keep one hand on the handrail at all times. And as silly as that sounds, when I worked for Zachary Engineering down in Texas, so what Zachary does, they're a construction company that builds power plants and refineries and performs maintenance at power plants and refineries. They have a lot of workers out there on very dangerous construction sites and very dangerous refineries, and their most common injury is slips, trips, and falls, and it's not out on the dangerous construction sites. It's in their office building. And what they found is it was all psychology. Their folks that are out in the field are trained and trained and trained and trained to be so aware, and they never really spent a lot of time training their folks in the office building. So during the year that I was there at Zachary, that was one of our biggest pushes, was safety in the office, because we already got safety in the construction field down. We had it figured out, but that office was lacking. So that was our big push, was actually getting people to hold handrails going up and down the stairs and to take the elevators when they were carrying something. Don't congregate on stairs or landings. Excuse me, sorry. Use the elevator when transporting heavy loads. Never use stairs or stairwells for storage. That's twofold. Though it is a tripping hazard, it is also a fire hazard. If you have a stairwell that is filled with materials and you have a fire, you now have an obstructed exit, an obstructed stairwell. That could result in people getting ultimately killed, especially since it'll increase the chances that fire is going to spread to your stairwell as well, where people are going to be going during that emergency. Make sure you keep your stairs well lit as far as lighting goes. And then back safety and safe lifting is going to be our next section. Again, we have another webinar that's entirely dedicated to this, so this is just going to be a really quick overview of back safety and safe lifting in an office environment. Make sure you avoid the need for hazardous manual handling. You're going to need to assess the risk of injury from any hazardous manual handling. So if you get a shipment of, large bulky objects or boxes that are heavy, you got to determine how you're going to move that. You shouldn't just have someone going and saying, "Oh, I'll just pick it up." That's how you end up with someone with a back injury. Reduce the risk of injury from hazardous manual handling by either doing team lifts or using mechanically aided objects. If you still have to manually handle objects, employees should inform the employer of any hazardous activities. So if they expect it's going to be heavier than what they're permitted to lift, they should inform their supervisor and come up with a plan to safely lift it. Employees should be trained to properly lift when they do need to lift, and they should follow appropriate safe systems of work. Make sure to use any lifting and transport equipment that's available to them for their safety. So oftentimes there are pallet jacks available or dollies available or carts available, and folks choose not to use them simply because they don't want to make the effort to go and get them from where they're stored. As far as proper lifting techniques go, we're going to go through a couple steps here, and then I'm going to break one down, and then we're going to finish up with the last couple steps. So number one is size up the load. Use a mechanical aid if possible, like a dolly or a cart or a lifting device, and get help if you need it. Check the object for any splinters, nails, or exposed staples so you don't get poked when you're lifting it up. And make sure that you have a clear path before lifting. Once you do start to lift that object, bring it as close to you as you can. Squat down, bending only at your knees and hips if the object's at floor level, and lift with your legs, not your back. The guy in this picture down here is doing it wrong. You can see he's trying to lift with his back, and that's going to cause a back injury. Keep your head up and your back straight while you're lifting, just like we see these guys doing here in this team lift. So you do want to lift as a team, you do want to use your legs, and you do want to turn with your feet and legs, not with your hips. Make sure that you use equipment to assist you when possible, and do not lift bulky loads alone. Don't twist when you're lifting, and don't use your back when you're lifting, and don't lift heavy objects unless it's a team lift or you have mechanical aids. And also don't reach before you lift. So if something's back in on a shelf, don't reach before you lift. I apologize, this next slide, I think it's going to say step 5. It's supposed to say step 3. Yeah, it does. So step 3, so after you've lifted it up, step 3 is going to be to move with it. So keep the object close to your body, look straight ahead where you're going, and keep your chest out and your shoulders back. This is going to help keep your upper back straight while having a slight arch in your lower back. That's how it's supposed to look. We can see that exemplified down in the picture on the bottom of the screen. Shift your feet to turn. Don't twist your body. When you twist your body, you're putting a lot of strain on those muscles in your back. And then get set and lower when you're going to put it back down. We're just going to go in reverse to put it back down. We're going to let our leg muscles carry it down and only bend at our knees and hips. Make certain that our fingers and toes are clear before setting down the object so we don't smash them. And then we get to the carts and wheels and our aided devices that are going to help us to transport material, so that we just have to lift it and sit it on, then we can push a cart. Do we push or do we pull? We want to push the cart whenever possible rather than pulling it. The reason for that is when you're pulling a cart, you're more likely to run over your feet. That's one hazard. Also, the bigger hazard is while pulling, if you're walking backwards, you're more likely to slip or fall. If you're on a grade and you do that, it's going to then fall over on you or run you over. And if you're pulling it while walking facing forward, your arm's going to be back behind you. And if you do that right now and put a hand, like put your arm back behind you like you're pulling something, you can actually feel that stress, even with nothing there, on your shoulder and back in your shoulder blade. That is going to increase the risk of back and shoulder injuries due to overexertion or bodily reaction. As far as the operators of carts, so now I'm speaking, you're going to want to train workers who use these on a routine basis, which would probably be in an office building, your janitorial staff, your IT staff who might cart around computer parts or laptops and things like that. They should be trained on appropriate body positioning for the type of cart being handled, which you could refer to the manual for that. And they should be trained on how to maneuver heavy loads and how to avoid heavy loading when possible. They should walk at appropriate speeds, a typical walking pace. They shouldn't be running with these. And they should, again, push rather than pull and stay squared and centered in front of it while they're pushing it. They don't want to be off to the side. As far as first aid in the office goes, and I do apologize, I am moving quite quickly because I see that we only have 10 minutes left here. That's not supposed to say stairs, I apologize. If your office has a first aid kit, make sure that you know where the kit is. All your employees should know where the kit is. How do you find out if all your employees know? Go out once in a while and ask your employees where the nearest first aid kit is. Make sure they know where it is, because you need to know where it is when you need to know where it is, right? Ensure that kit is kept well stocked. There are third parties that can help you with that, like Cintas, who will come in once a month and make sure everything's stocked and filled. But in an office environment, you're probably not using the first aid kit much. If you don't already have Cintas coming out, you can certainly do something like that yourself. Assign that to a member of the safety committee as one of their responsibilities. Again, in the state of Washington, if you have more than 10 employees, you must have a safety committee. And if you have less than 10 employees, you still have to have a safety meeting. Consider taking a first aid course and having some employees also trained. Any employees that you have trained, you should keep a list of their names next to the first aid kits. I recommend CPR, AED, and first aid training for all employers, especially office buildings. At Marathon Petroleum, when I was there, they had a big push to get all their employees. They wanted 80% of their employees trained in first aid and CPR, and they hit that goal before I left that company. And at the corporate office, actually, some of the workers had an app on their phone that went through this that would alert anytime someone nearby needed CPR. Or an AED. It was actually configured with the 911 system to summon responders faster, so that people that were nearby trained in CPR would be notified and get there even before an ambulance could arrive. And we actually had one employee at Marathon actually saved a life across the road from Marathon when that alert went out one day. So definitely helpful not only for your company but for the community to get more of your employees trained in first aid and CPR. And make sure your employees know how to summon the emergency services through the appropriate routes. Make sure they're trained to do that. General responsibilities for your employees in an office building. They should cooperate with safety, security, and emergency personnel. They should be obeying environmental health, safety, and security rules. They should complete the required trainings for their jobs. And they should report all injuries, accidents, and incidents, including near misses, as soon as possible to a supervisor or whoever your policy indicates those should be reported to. Make sure that they are reporting known or suspected hazards and risks as soon as possible so that you can mitigate those before someone does get hurt or exposed to something dangerous. And do not expose yourself or others to unnecessary risks. As far as hygiene responsibilities for employees in general, they should be practicing good personal hygiene to reduce their risk of illness and disease. They should be washing their hands frequently using soap and water. And they should keep their office areas and work areas clean. Leave them in the same condition you expect to find them. Make sure they report any cleaning needs to custodial services and keep restrooms and break areas clean as well. And report cleaning and maintenance issues as soon as possible. And this last section here, it's going to take me a few minutes to get through. We might finish just a little bit after 2 o'clock here. We're going to talk about workplace violence. This is an extremely fragile topic. This is a topic that is of increasing importance in the United States as we see workplace violence increasing. As well as each situation is going to be a little bit different. I definitely recommend you have a general workplace violence policy in place. I also recommend that you train all of your employees on that workplace violence policy and that you have a code word in place, and we will discuss the importance of code words in a little bit as we move through this. So bear with me. There's going to be a lot of information on these slides. They're going to be very wordy. I do apologize for that, but there's not really a way to make these slides brief for this topic. So general criteria. Situation number 1. Situation number 1 is dealing with an agitated individual that presents very little threat of immediate harm. So this is essentially just going to be your upset customer or an upset visitor to your facility. If an individual, including an employee or customer, enters the workplace and becomes agitated, steps should be taken to diffuse that situation if possible. Avoid accusations, avoid pointing fingers, avoid making you statements or telling someone to just calm down. That is going to escalate this workplace violence incident. We've seen that in the news just with coronavirus, with folks who don't want to wear masks getting mad and yelling back and forth and pushing their way into buildings. That is because accusations happen, finger pointing happened, you statements happened, people were told to calm down instead of following actual violence diffusion techniques. We want to diffuse those situations. So how are we going to do that? And by training all of our employees on this, we're going to avoid having our workplace end up on the news, whether it's because of our employees misbehaving in the situation or an agitated customer misbehaving in the situation. Either way, we don't want recordings of this to get on the news. It's bad publicity all around. So we want to remain calm. Your employee should remain calm. The person who's having an outburst should not be able to assert control if you remain calm. Therefore, the employee should do their best to remain calm and think through the situation. They should follow applicable procedures. Again, you should put a procedure in place, and they should follow those procedures as planned as best as possible. We need to recognize that every situation isn't going to allow the procedure to be followed to a T. This is going to allow the individual confronted by that angry person to more effectively concentrate on dealing with the situation at hand. And we need to realize that this angry individual is not thinking rationally. So we need to maintain our rationality and our calmness and position ourselves between them and an exit. That way, if we're the person that has to diffuse the situation, if we're the one stuck in the situation with this angry individual, we have a route to get out if they do escalate and get violent. Listen carefully to the angry individual. A lot of times they just want you to listen. That's all they want. And once they get whatever it is off their chest, they calm down and they usually regret what they did and they're outburst and they're embarrassed. That's what we want to have happen. If they get it off their chest and now it's over, that's great for everybody involved because it's over. If you listen carefully to what he or she is saying, they are more likely to understand what the person is looking for, and thus you're better able to diffuse that situation if you understand what their angle is, what that angry person's angle is. It's important to mirror back to the individual his or her concerns. It makes it clear that you're listening. So things that they say, repeat them back to them calmly so that they know you're listening. And do not ignore body language. Make sure you sit in a comfortable posture, if possible apart from the individual, or if you're standing there, don't look stiff, don't look upset, and don't look like you're uncomfortable, even if you may be. The more calm you present yourself, the more comfortable you present yourself, the less likely you're going to be perceived as aggressive. And time is on your side. The longer you can keep that person from achieving their purpose, the more likely it is that their emotions will start to wane and they will start to kind of come back to reality and calm down. That makes it more likely the individual will stop. And cooperate. This tool is used to show the individual that any problem can be worked out if people cooperate with one another. So show him or her that it's possible to work with others to resolve the problem and that you're willing to help them do that, and explain that very few mistakes are beyond correction. All right, situation number 2. Oh, sorry. I forgot about this slide. The use of the yes and technique. This used to be called the yes but technique, but that's outdated. We now say yes and. This allows the employee to agree with anything the angry person is saying and attempt to persuade them at the same time. So you validate their anger. You validate that, yes, something upset them. So, yes, I understand, and here is how we can move on, and here's what we can do. So, yes, and. So agree with them and propose solutions or move the conversation forward, instead of simply stating that they're wrong. They may be wrong, and you may very well disagree with them and think they are wrong, but if we say yes and, it's going to help to diffuse that situation. And again, we're just trying to draw this out for a longer period of time in order to get them to calm down. If the individual does become more agitated, which can happen, it's less likely, but it can happen, you should then seek assistance from another individual. At that point, the employee should attempt to call for assistance and calmly explain to the agitated individual that you're going to get assistance from someone who can help them, whether that be a manager, a supervisor, someone higher up. A lot of times, these angry folks just want to talk to somebody who they think has more power to do something, and when it's the manager saying, "I'm sorry, this is all we can do," sometimes that's all it takes instead of it being the employee saying it. The affected employee should attempt to isolate the threatening individual to the greatest extent possible. So in other words, get them towards a conference room or towards somewhere that's away from a large amount of people. That way, if they do become violent, more people have the opportunity to evacuate. For example, the individual may be led to a conference room and kind of left in there while you go and get some assistance. Maybe they'll sit down in that conference room by themselves while you go and get more assistance. And sometimes getting more assistance could mean getting security or getting the police if this person is looked at as a threat. Again, we're about to hit the 2 o'clock mark. This will be uploaded if you do have to go. I'm going to finish these out. I have just a handful of slides left. Keep yourself at a safe distance at arm's length. Position yourself near a door if evacuation is needed. Situation number 2 is going to be the individual is violent or poses a threat and evacuation is possible. In this case, if the situation can't be diffused, it's clear the individual is dangerous or has some type of weapon, the employee should take immediate action to obtain assistance. If possible, the employee should get up and remove themselves and create an obstacle if at all possible if they're going to chase after you. So knock over chairs, close doors, lock doors behind you, and text or call 911. And if you have a code word for evacuation, get that code word out as well. Designate a code word to be used to alert other employees. For example, I have a There is a funeral home that uses a code word that is a Keller and then earn. So for example, I'm not going to give you their color because just in case anyone's ever going to be the aggressor at that funeral home, let's just say it's green earn. So if we notice a threatening individual or someone's posing a threat, we can go up to another employee and we can say, hey, Susie, can you go get the green urn from the back? And so Susie will go looking like she's going to get a green urn when really she's going to notify the rest of the workplace that there's a violent individual and they need to evacuate. If the individual has an individual alarm or panic button, they can use that, but most workplaces don't have those. The contacted individual should immediately call or text 911 if possible. So Susie was told green earn. So when Susie leaves that room, she's going to contact 911, and she is also going to start to initiate the evacuation process. If the building is evacuated, if possible, you should try not to induce the violent individual into noticing the evacuation. That could trigger them to actually start acting out with the violence instead of just threatening when they realize that their potential victims are leaving. So we want to try and keep that a secret from the violent individual if possible. Now sometimes that individual may be an employee and would know the code word, in which case there's not much we can do about that other than try to keep it secret from that room that they are in. What we do not want to do is pull a fire alarm. That's why a code word is better. If you can put a code word over the PA system instead, maybe your code word is something about food trucks in the front parking lot and you don't even have a front parking lot, something like that, where it's kind of coded to sound like a normal announcement, but everyone that works there will know it's not. At least 2 individuals in the building should have a map of the building so that it can be provided to law enforcement. The reason 2 individuals should have it is if there is an incident on the 1st floor and or on the 10th floor and we evacuate, we want someone that's not on that 10th floor to have a copy of the map in case that person on the 10th floor is stuck in this situation and can't get out. And we want law enforcement to have a map of our building in case they do have to make an entry because of a violent individual who is maybe an active shooter or something like that. As much as you think this won't happen to you, I am the first person to tell you it can. This happened on the pipeline site I was working on in July of 16. So you may think you're never going to deal with a shooter, and the day it happens is the day it happens. So you should have these plans in place. Make sure you account for those employees. Have a method in place for that, whether that be supervisors keeping a list of their employees and meeting at a muster point to make sure they are all there. A mobile phone should be used immediately to call or text 911 and apprise law enforcement of the status of any non-evacuated employees. And lastly, this is going to be when the individual is violent and evacuation is not possible. If it's impossible to safely evacuate the building, we want to use that code word and indicate the immediate need to call or text 911 and the immediate removal of employees to a safe room or place. Use a designated code to alert other employees. If the individual has an individual alarm or panic button, again, activate it right away. And that person who is contacted or given the code word should immediately call or text 911. Secure yourself in a locked area. All doors and windows should be locked, and the same accounting procedure used for evacuation should be utilized. Windows should not allow the assailant to see into the room, so you may need to block or barricade windows as well if there are windows out to the hallway. A mobile phone should be used to call or text 911 and keep law enforcement apprised of the information of the status of anyone inside. The use of the code word should be done discreetly when possible unless other employees are at immediate risk and need to be alerted. In this instance, it may be necessary to shout that code word loudly and repeatedly. All right, and then the very last slide I added here is because of COVID-19, we got a lot of teleworkers working from home offices. So you as an employer should provide guidance for what is best or what is safe in a home office environment, including a good workstation setup and how to keep physically active. Require employees to familiarize themselves and comply with good ergonomics practices, for example, by referring them to a self-assessment checklist, which I will have linked down here on this slide, and maintain daily communication with workers, provide continued access to employee assistance programs, and appoint a contact person in the business that workers can talk to about any concerns for mobile or work from home. Oftentimes that'll typically be someone from HR and someone from IT to assist with those situations. You should also think about how your existing policies and procedures apply when working from home, including notification of incidents, injuries, hazards, and changes in circumstances. If you have a worker get injured at home, call your representative at Compwise and we will assist you in determining if it is going to be considered a work-related injury or not. And consultation and review of your work health and safety processes, attendance, timesheets, leave, and other entitlements and arrangements. You can't just assume your teleworkers are going to know how to do these things. You need to instruct them on those things. These are all just review topics, so I'm not going to read through all these. These are a review of the ergonomics topics we hit on before, just for the home office. Lastly, unique to the home office, IO psychology. Remind your workers to maintain a routine. We're creatures of habit. When our routine gets disrupted, we go through emotions such as helplessness, despair, anger, depression, frustration. So getting a routine going for the home office is just as important as getting up in the morning, driving to work, and having a routine throughout the day there. Don't use their extra time to work. So encourage your employees, if they normally get up at 7 and drive for an hour to get to work, they're still going to probably get up at 7. Tell them don't work from 7 to 8 unless you want to tap out early. Instead, from 7 to 8, why don't you relax, watch some TV, drink some coffee, read the newspaper, sit in the garden. Any extra time you have, don't use it to work. That is your time, not our company time. Use video chat. For many of us, in-person contact is important because we're able to read social cues. So have a team meeting once a week via video chat service like Zoom or Skype, so that you can see each other and be social again. And remember to take breaks when you're working from home. Being in the office lends itself to chit-chat with coworkers around the water cooler and things like that. When we're working from home, we end up often sitting there for 8 hours straight and taking no breaks, forgetting about lunch. Remind your workers to take those breaks. It's important because if they sit there for 8 hours straight, they're probably going to get less work done than if they took a 5 or 10 minute break every hour, because they're going to start to become unproductive. They're going to start to get kind of lost in that work. And tip number 5, move around. I'll often go out, walk around my garden for a little bit when I take a little break from work at home. Again, it helps you to maintain a focus on your work when you come back from that break. Otherwise, you kind of get lost and distracted while you're working if you're not taking formal breaks. And here is that checklist I mentioned for employee safety. Again, this will be on the PDF I send out to you after the presentation. This is one that was made by the federal government for their federal workers that are working from home, and it is a great checklist for safety in the home as far as a home office goes. All right, and that is it for today's presentation. I apologize I went about 8 minutes over. There's my contact information. Feel free to shoot me an email or follow me on LinkedIn for updates. So thanks again. We have other webinars posted on the CareWorks State Fund TPA website for Washington. That'll be in my email signature when I send you these slides in an email if you want to check out our other webinars that are available. So thanks again. Have a great weekend. I apologize for keeping you a little late today. Stay safe, everybody.